Okay. Something happened. My iPad just crashed and closed the Facebook. So I'm really sorry. I hope you're still there and you can connect again. We were almost 40 for the first time. So I was talking about the position, if that can affect your how you swallow or something like that. Well, I was telling you, probably. Uh, well, I'm gonna wait until you get connected, or you're not gonna get the answer in real time. So, hello, Jason. Hello, Lolita. I don't know what happened. My iPad crashed, and I'm waiting for our friends to join again. We were almost 40. I don't know what happened. Stephanie, good morning. I already saw that, so I know you're here. I'm gonna like that. So I was in a different video, and my iPad just crashed and closed the Facebook. So sorry, we're gonna wait until our family's here again. Okay, okay. Hello, Amanda again. Julissa, and down. Sorry. We're gonna wait a minute at least and see if we can get our family gathered together again. We were 40 for the first time, and then my iPad decided to crash. I don't know why. Okay, welcome, welcome. Sorry about that, it was a technical problem. No, I didn't see the last questions. Please ask me again. The problem is that my iPad just crashed and decided to finish with our services. No, I don't know what happened. Yeah, I'm back. I'm back. So please, I will see the questions later, or you can. Yeah, it is live, Janine. The problem, I was in a different video, but the problem is that my iPad crashed for some reason and decided to suicide, and I don't know, it just killed itself. Your question, okay, Tony, your question was, if you don't qualify for financing and can't afford surgery, what recommendations do you have? Well, I recommend you to try a personal loan on Wells Fargo, for example. They have been telling me a lot that my patients should try that they have really low fees, and I think the prerequisites are less or something like that. You can do a GoFundMe campaign. Some people is doing that, or I don't know. Normally, people ask the family to help them with that. But in the meantime, that doesn't mean you have to. I mean, just quit. You have to do your part. I mean, I've had patients losing up to 84 pounds before surgery because we coach them. I think it's 12 white. Because we start working together to help them to lose some weight with some diet, and that's going to decrease your cardiovascular and anesthetic risks and surgical risk, of course. So in the meantime, there are no excuses. Even if you don't have the money and it's going to take you some time, you need to start exercising and dieting today, but not dieting like you want to kill yourself with lettuce and water. I mean dieting like properly, getting your protein, getting your healthy fat, healthy carbs, 6 meals a day, of course 3 main meals, and three snacks and stuff. I mean, start working on that part at least. So no excuses. Julissa, when you use a faja, you can only treat. Well, that's a mechanical restriction. I think you can use it if you feel comfortable. If you're looking for some contour and stuff, I think some of them really helps. I've seen them after surgery, after plastic surgery. I'm not sure if they are gonna work by themselves, but if you feel comfortable with it, you can use it. And then if you're gonna eat, take that in consideration. And Joy, hello, Tony. Okay, do we have it froze on your question, Kenya? I think your question was about drinking standing up or sitting down, right? Okay, I was telling you that sometimes the inflammation of the esophagus, sometimes the inflammation of the stomach are gonna make this effect, and probably the position is helping you to drink better when you're seated. But that doesn't mean you're not gonna be able to drink standing up. I mean, that's for now that you have some inflammation. So give it a time. Give probably I mean a month or so. Oh, Tony, well, that's actually good. 24 pounds in 6 weeks. That's great. That's great, but that doesn't mean you need to quit, okay? That just means you're doing great and you need to keep on that path and stay on that path. Colita, I'm couldn't. Okay, Colita. I think Eduardo can take care of that. Yeah, no problem. We can take your tests. You're coming here, so you're in my territory. You're in my kingdom, so we will help you. Joy. Yeah, it is. Of course, it's a great weight loss for Tony. I know. And yeah, and Lakeisha. Thank you, Lakeisha. And you understand perfectly what Tony is saying, right? And that doesn't mean you have to quit, right? You are on the contrary. You need to keep learning. You need to keep exercising and pushing yourself and do your part. Don't take this surgery as it's gonna solve all your problems. It's gonna help you. It's a tool, an amazing tool. We are here to help you also. It's a system, but you have to do your part. So even if you don't have the money right now, I mean, we need to work on that. Okay. Okay. Hello, Julia. Yeah, Amanda, you're at, well, that's a good question actually. Can we sleep on the stomach after pass up? Yes, you can. No problem. Because um, let's get rid of that concept. You're laying down on your belly, not on your stomach necessarily. I mean, your stomach is inside your abdomen. And I'm gonna stitch it so good that there's not gonna be any problem laying flat on your belly. And yeah, Lakeisha, that's what I'm telling you. I mean, there are some groups like this group that probably some people doesn't like that kind of campaigns. That doesn't mean you can't do it. What I mean is you can do your campaign, you can share it on your Facebook, you can share it with your family, with your friends, you can share it in some groups. I mean, it's not like you are not welcome, it's just that some people get a little, I mean, the thing is, lots of people is having financial problems to get the money, but that doesn't mean you can't do it. It's just be more probably selective. I'm sure your family is gonna be willing to help you with something, and your friends. I mean, it doesn't bothers me necessarily, but I get lots of reports about this kind of stuff, and we try not to advertise. I mean, I I'm kind of advertising myself in it's my group, of course, but I don't do this a lot. A lot of the, I mean, it's more like an informative and supportive, and it's more like a real support where we try to take, all kind of advertising out of the group. It's not just the campaigns. I need to be clear with that. And Janine, on the mini gastric bypass, how do you check to see that the remainder of the stomach has been properly sealed with the stapling and will not leak. I know you do a leak test on the pouch. Okay, we actually don't do a leak test on the remnant or remainder of the stomach, but we basically, when we shoot the staples to cut the pouch, we do the leak test on the pouch, as you're saying right now. And remember that the stapling is reciprocate. I mean, you do have 3 rows of staples on this side and 3 rows of staples on the other side. So you can, actually that's what we normally do with the sleeve also. We do a second leak test, insufflating the stomach. If that part is sealed, you can predict that the other part was stapled correctly. And actually we always go and triple check the remnant part. And there's one more thing. I always shoot some clips, not just the staples, but I shoot some clips to prevent bleedings on the remainder of the stomach. So also when I do the rewind and I cut the intestine, I shoot clips, I mean always, and as many as I think are necessary, just to be extra sure there are not going to be any bleedings. So yeah. Kenya, actually, I'm not recommending that brand, the Bariatric Advantage, because it's not any better than other vitamins, and I think that's Alex Breacher's company. He started to make a lot of money after we started doing the medical tourism company. So no, I don't work with that brand at all. I don't recommend it. Also, you don't need necessarily bariatric vitamins for the sleeve gastrectomy. Probably you do for the bypass. Remember that adding malabsorption is gonna give you some other issues on the long term. So with the sleeve, even Flintstones can work. And you can ask the ladies or guys in the group, they get their control 3 months after surgery, and most of them are having really high vitamins, actually, like B12, super high, for example. Lolita. Okay, I'm glad you're excited. Oh yeah, and the position can affect sometimes, because remember your stomach is not a bag anymore. It's more like a tube, you know. So of course, if you move some places, probably the tube can bend a little bit. I mean, give it some time until the motility and the muscles start contracting again, and you can have a perfect gastric emptying. Vitamin patches. I'm not sure. This is the thing. I never heard of all vitamins being absorbed by skin. I mean, I know some can be. I'm not sure you're gonna get a proper, levels on your bloodstream with the patches. I don't recommend them, but I don't tell my patients not to use them. Actually, I'm curious about it. I would like to know what's happening. The thing is, even if your blood work gets back normal after the first 3 months, I'm not even sure if it's due to the patches or because they are eating properly, and because your protein shakes has lots and lots of vitamins, and a lot of your supplements are going to have lots of vitamins. So I'm not even sure if it's if the reason that your vitamins are okay are the patches or your diet. My MCL in my right knee is tore. It's like the cruise ligament of your knee, I think. Exercise suggestions. Well, you can always exercise your core and all your upper body. Okay, I know you can't do your knees probably, but you can do that. Also, you can exercise your femoral, not the quadriceps on the front part, but your femoral muscles on the back part. I mean, if you try to do the machines for the quadriceps, you probably are going to have some trouble in your joint with your ligament. But there's an exercise. Well, what you do is bend to the front and just stand up, and bend and stand up, trying to keep your legs straight. That's going to help with your femoral and glutes, and that's exercising. That's good. You can also walk as much as your knee let you. You can try to swim. That will be the most amazing exercise for you in any case, swimming, but it's not always a possibility. So that's the thing. And do you have a phone number for the Wells Fargo contact? Oh, yes, I do. I can send it to you later. Please send me an inbox, Francis. I will send you the card with the number. I have a picture of the card there. Hello, Jen. How are you doing? Michael Anderson. What is the cost for gastric bypass, and who should have bypass versus leave? Oh, that's a good question, and I'm glad you asked. I prefer the bypass for patients with severe diabetes or patients having severe acid reflux. Also, it could be a personal choice. I mean, I don't have any trouble doing the bypass on people that just wants the bypass. The thing is, I always consider that we need to be sure that risk benefit is worth it. The sleeve and the bypass can be as successful on the long term if you have the proper advice. It's not true that you're going to lose more weight with the bypass than with the sleeve. Actually, a lot of studies prove that some of them are proving that the bypass is better, some of them are proving that the sleeve is better, but on the long term, the biggest studies, when you do the meta-analysis, the weight loss is almost the same the first 1 or 2 years. The difference comes after 5 years of metabolic control, not even the weight loss. If you don't have the proper follow-up, if you don't have the coaching system I'm offering right now, or something like it at least, you can gain weight back with the bypass or the sleeve no matter what you do. I mean, if you start making the same mistakes, if you don't know how to exercise, if you don't diet properly, and by diet I mean you change your habits, not dieting like killing yourself with water and lettuce. I mean, like, your diet from now on needs to be different. So I believe if you're looking into weight loss and you're not diabetic or healthy, the sleeve should be more than enough, and you need to be disciplined. And the same applies for the bypass. So there's no big difference there. So if you're just looking for weight loss, you can talk to our patients here. There are some patients that just get, actually, Danielle, Jades, or we have some so I think Lindsay Lou had their surgery like 2 years ago, something like that. We have a lot of people that had their surgeries like a year or 2 or 3 ago, and they're still successful because they can tell you that they are disciplined. For example, ask Edna just published her surgery yesterday, I think. So Edna Ortega. So I'm telling you, they had their surgeries a year or more ago. They're still successful. They look amazing. They are following the diet. They are following the group. They are not quitting. They are still learning. So if you do that, the sleep should be more than enough. But if you are diabetic, that it's definitely proven that the metabolic control in the long term is going to last longer with the bypass than with the sleep. But also, the vitamin deficiencies and anemia and malnutrition and the dumping syndrome are more common with the bypass. Again, it's risk benefit. Do you think it's worth it to get the dumping syndrome that is terrible? It feels terrible and it's dangerous. Is it worth it to get possibly malnutrition, vitamin deficiencies and that stuff? If it's worth it, we can do the bypass. Also, if your quality of life is terrible due to reflux, I definitely recommend the bypass. Okay, next question. I know, Francis, I know a lot of people is gonna criticize you if you use GoFundMe accounts. I know that. The thing is, do you really care? I mean, you are not trying to be popular, okay? You are trying to get some help. I don't see anything bad about it. I mean, just you can do it. You can ask your friends and family. You can send it. I mean, at the end of the day, it doesn't matter how you did it. I mean, you need to do it for yourself. So don't feel bad if they are criticizing you. I mean, I don't think that's the point. Jessica Gibson, how can get your family and close friends to support you in this journey in surgery and going to Mexico? Well, first of all, I can offer you to talk to your family and your friends if it's possible, if you like, if you want me to, and I can explain the process better. The problem comes when they talk without knowing anything. I mean, they are, most of them haven't been in Mexico at all. They think that what they see in movies and stuff is the reality. You know, like you're going to this kind of desert with a lot of people using ponchos and drinking tequila and shooting, their guns to the air and stuff. I mean. That's the problem. They need to get information. Same for you. I mean, think about it. Think about this. I don't think you were convinced at first. I mean, you had this time when you were scared of coming here and you weren't sure if it's a good idea. At some point, you got convinced because you got a lot of information. So they need information too. They need to see our hospital, our hotel. They need to talk to people that actually had the surgery and the experience. They need to talk to me, probably to the doctor, to know that what I'm doing is correct and it's proven to be effective and it's safe and we have good facilities and stuff like that. So what they need is information. After that, I'm sure they will support you, or at least some of them will. Yeah, that's true, Lakeisha. I'm gonna like that, definitely. Colita. Oh, yeah. Okay, let me answer Colita. Colita, about the ounces. Mm-mm-mm-mm. Remember, your goals are your macros and your calories. It doesn't, I mean, you can get 1,000 calories in 3 ounces, or you can get 200 calories in 3 ounces. So the amount is not the only thing here. Remember that, please. Remember that. And everybody's different. Remember, the length of the stomach is different. The capacity is going to be different. Even though it's the smallest caliber possible, the length is different in every patient. Jenny, while in procedure in the OR, do you have a way to secure viables, passport, iPhones, money? Yeah, we do have a safe on the administration, and you also have a safe in your room, I believe. But some people don't like leaving things in their room, so we can give it to the administration for that. Ednita, how are you doing, Edna? Congratulations. Felicidades, tu primer surgiversary. Felicidades, Ednita. ¿Cómo estás? Gusto de saludarte. Glinda, I don't normally do surgery 7 days a week. We normally take Sundays for resting. You know, it's our day off. My teammates have families, so their families are gonna kill me, I'm sure of it. So we try to take Sundays, but sometimes, as today, it's not possible to change the dates due to the working days the patient asks. Well, there are some things we need to consider, and there are some exceptions because, for example, we have surgery today, but we normally don't do on Sundays. Mary Angelo. Do you do stitch suture the 5 incisions or the skin? If not, well, what we do if they get infected? We do suture the incisions. It's a subcutaneous stitch that we have several layers of skin. So I use a suture that comes this way, and then on the other side the same. And it's gonna look like it's glued, but it's actually suture. And it's a dissolvable suture, so you don't need to do anything. And I don't think it's gonna get infected because you're gonna have broad spectrum antibiotics while you're here through your IV. You're gonna have antibiotics when you leave, and you just need to keep them clean and dry with soap and water. So there's no reason why they should get infected. Oh, Tonya, I'm glad you're asking about the referral. Yeah, you can refer as many people as you want and even get your surgery for free if you like. Remember that the referral system started as to help you and help me. Instead of paying Google ads and other stuff for advertising, I prefer my patients to refer us more patients. I'm sure you're doing it because you like the service, not because I'm paying you or something. It's just a way of thanking you for the support. That's one thing. Second, remember that the support of the referral includes the like kind of a follow-up until the patient has the surgery. If the patient you are referring is not going to have the surgery, I'm not going to have the money to pay you. I mean, the referral, and I need you to be reminding me. For example, now I have to pay 2 referrals to a person right now. I know I have to do it. I'm gonna do it, but sometimes I don't have the time to cross the border and pay. So it's gonna take me some time to do it, but I always do it. I promise. So I will do it. So just please, we need to get some control on the referrals. I mean, I need you to follow up with the patient and see if they are having the surgery, if they're afraid of doing it. It's not just to throw some name, and I'm sure if you throw the name, I'm gonna go for a hunt. That's true. But the thing is, I need to know it was referred by someone, and I need the person that is referring this new patient to tell me and do some follow-up on this case, until the patient pays. Or there's no other way to control this, It's not just telling people, go to Dr. A, and that's it. No, the referral is more like, well, I recommend you my doctor because of this, and then just let me know you're referring someone, please. Danielle, probably this comment had more sense before, but now I just read glutes. Good comment. And France. Okay. Alina, hey Dr. A, been listening to you. Oh, that's great. Veronica Ortega, hello. Edna, diabetes free since 4/26/2016. Yeah, mini gastric, no GERD. Great, Cindy. I'm glad. I'm telling you, we need to customize the treatment. I don't think the bypass is for all patients. I don't think the sleeve is for all patients. I mean, we need to customize the treatment. If you have a really high BMI, that's where the sleeve is mandatory. Remember, that's the reason why the sleeve was discovered in the first place, because we need to decrease all risks of leaks and bleedings. So that's another reason to choose the sleeve over the bypass. If your BMI is super high, and I mean over 58, 59, 60, it's already really risky. So I would definitely recommend the sleeve. Hello, Christine. How are you? Thanks. Katie Smith. Hello. Paul, it's been a while. Yeah, everybody hears Mexico and gets scared. And nowadays, it is scarier to go to the States. There are lots of people with guns. Actually, the only problem remember this, the only problem we have had um, with the safety of our patient, it was a guy shooting people with a sniper rifle on San Diego, close to San Diego's airport. So that was on your side. We haven't had any other issues here. Daniel, you was hoping for tequila and punches, and you instead you got brought. Okay, that's so funny. And Michelle, you had acid reflux prior to the lab ban, and then subside. And well, I don't think the reflux is gonna recur if we dissect the esophagus correctly and we do the sleep the proper way. If you are afraid of having reflux, there's when we can consider the mini gastric, for example. Also, because if it's a revision, so lab and to sleep works definitely, but I would rather prefer to add some malabsorption to that. So if you already had the lab band, I'm between the mini gastric and the sleep. We need to talk about it. Okay, I think I'm really well. Let me check because I'm behind all of the comments. Crystal Nicole Valle, how long should we take the Prilosec? Well, at least 6 weeks. At least. Yvette Marie, you have the Leban. I can definitely take it out. I can definitely do the bypass at the same time. Unless your Leban is so, I mean, there's so much scar tissue or some risk of hurting the stomach or your Leban is eroded and we need, I mean, if you have some kind of damage, we probably are just gonna fix the damage and we are gonna need to wait a couple of months for doing well surgery. Never happened to me, knocking on wood. Until now, I've been able to convert all my Leban to sleeves or bypasses, but I mean, everybody's different. I have posted on my YouTube channel some of the really difficult and awful cases of revisions and stuff. So I'm sure I'm more than capable of doing your surgery. Don't worry. But as I said, if there's any risks, I'm not going to take any chances. I'm going to fix the damage and that's it. But until now, knocking on wood again, all of my revisions have been successful. And we need to talk about the bypass, the room wide versus the mini, because nowadays the mini looks to be more effective on the long term and other stuff that I'm really into that. I really prefer the mini over the room, but well, not, I do both. Actually, we had a room wide like a week ago or 10 days ago. I mean, it's the same. Candice, hello. Anita. Actually, Francis, I don't upload all pictures, not from the surgery, not from our patients. The website is being frozen for a while. I haven't been updating pictures there because I have more than 100. Nobody's gonna check more than 100 pictures. I mean, you're gonna see the first 10 probably successful cases, but I stopped uploading pictures to my website like months and months ago. I don't even remember. And on the group, if you don't want me to, I won't post them. It's not mandatory. It's just when actually normally the patients ask me to post the pictures. If I post any medical pictures, I don't put the names. So I mean, don't worry about that. Yeah, that's true, Joy. And yeah, the referral program was meant to help other people to get their surgeries. I mean, if you can get 44 people, you're gonna get your surgery for free. I mean it. And yes, Jeff, the word of mouth is excellent. It's the best advertising out there, definitely. I'm sure of it completely. Thank you, Paula. Thank you. I'm gonna keep doing it, I promise. It's really effective because actually you can watch the video later and you're gonna get lots of answers also. So, and no, Paul, I'm why do you think I'm gonna forget about you? Never. I'm here for you anytime you need. Just send an inbox. Nita, a shot before surgery to eliminate nausea. We do. We premedicate our patients with Sofran, omeprazole, and we also give a shot of morphine. We start the morphine before surgery in your shoulder. Don't tell anyone, that's our secret. We start treating pain before it started. So before it starts, before cutting the skin, you already have morphine. Okay, perfect. Irene Neteri Gomez, welcome. Billy, welcome. Claudia, how are you? You can catch this? I'm gonna like that comment and that's it. Melissa, you can wait, but we have to. That's sad, but we have to wait. Just kidding. Jenny, from the time we get to the hospital, about how long before we going to do R for the procedure? Well, it depends on your flights. If you arrive at 9, you're going to cross the border and get to the hospital at 9:30, something like that. We're going to start the blood work, EKG and chest x-rays, and you're going to be ready by 2 p.m., probably 12 p.m., but normally we get there to 3 p.m. Until 3 p.m. because I do the consults, remember, in the mornings. So I have the consults, then I go to do the surgeries. And thank you, Joyce. Rob, how are you? Okay, now it's getting fun here. Okay. About paleo diet lifestyle. Well, it's my understanding that the paleo is kind of the diet the humans used to have centuries ago, right? Like on the caveman and stuff. It's okay. I mean, if it's like natural, like I don't recommend you to get raw meat, of course, or buy the head of a chicken or something like that. I don't know what it includes, but if it's just natural, non-pesticide and that kind of food, I think it's okay. I'm not sure if that includes anything else like hunting or gathering seeds and stuff. I'm not sure, but I don't think it's bad. I mean, I think it sounds like logic, for me. It's common sense, I believe. Janine, how often do you do sleep to bypass revisions? And when do you consider doing it? Well, we just did one 2 days ago, I think. Yeah, how often? Once in a while, every one a week, probably. Not every day, but fairly, common procedure, not a lot. And I can tell, at least until now, and I think I'm glad that I've never done one of my patients. I've never converted one of my patients from sleep to bypass until now. I hope not to do it ever. I don't want to do it. I want my patients to be successful. Okay? I've been revising patients from other doctors. Normally the rule is with no follow-up at all, no support, no coaching. So when do you consider that? When the patient is gaining weight back and they are supposedly really trying. Actually, the first consult I give to a revision is, are you really trying? You already have the sleep. Are you sure you're following the diet? Are you sure you're exercising? We start to try to save this case before making more damage or a more aggressive measure. So if the patient is gaining weight back, is frustrated, is having an effect on the mood and the family and everything else, and it's really trying to lose weight and it's impossible to do it, we might do the revision. That's the general rule. Francis Bell, if you have a CPAP machine, are you supposed to bring it with you when you have surgery? Yes, you are. You are supposed to bring it. We do have a CPAP machine here, but the hospital is of course gonna lease the machine, so you're gonna pay an extra, I think like $50 per night or something like that. So if you have yours, please bring it. Estela, you're doing great. I'm glad. Oh, definitely, you have a great teacher there. Hello, Sadie and Elizabeth. Okay, thank you. Thanks for your information. Yes, we can definitely take your gallbladder. Actually, we just did. I had two gallbladder surgeries yesterday. We did the sleeve and then we removed the gallbladder because they knew they had stones. Actually, I have some news. I'm gonna post it on the group later today. But I get an arrangement with the hospital, and instead of charging